And we are now live. Maria Daniels here with Successfully Chaotic. And this is actually a wellness show. So a lot of people have asked me, what does NAHF mean? And some of you know already that I do have a wellness company called Natural Approach Health and Fitness, hence the NAHF acronym. And I wanted to do a show that was solely based just on wellness and all things related to wellness. And today I have a special guest today. She is a licensed massage therapist. Her name is Brittany. And I'm going to have her just go ahead and dive right in, introduce herself, and tell everybody just a little bit about what she does.
Hello, and thank you so much, Maria. I appreciate that. I have been in practice for the last 13 years, serving the Central Ohio area, providing rehabilitative type massage therapy. There are many types. Many of you guys are aware of the relaxation, deep tissue, myofascial release, shiatsu. All of the massage types have a place in the grand scheme of things, but they're all very different. And I'd like to talk a little bit today about how they're different and which one might be right for you.
Absolutely. And I think that would be great. And I love massages. I'll be one of those people tell you I love massages.
Awesome.
And until you were just now speaking, I honestly didn't realize there were so many options. I did know that there are obviously the relaxation massages and then, the more medical. I always thought medical and deep tissue was the same thing. So I would love if you kind of broke that down and explain the differences and benefits related to each of those, because I did already know that I was not one of those people that want to just say, oh, that's just such a nice massage. I've had 7 children. I used to do MMA, so I've got all the injuries. And Suzanne is actually, I work with her, and she can tell you how big of a hot mess I am. So like that just is not my thing. So, but I would like you to kind of share with everybody just kind of the differences in those different types of massage.
I would love to do so. So deep tissue and remedial massage are very, very close in style. The difference being is deep tissue can be remedial, but not always. Sometimes you just want a basic massage touching over the whole body at a deeper pressure. And that's more what deep tissue is in my mind. So remedial work is just a little bit different, and it has a lot to do with a fascinating structure in the body called the fascial line and how that applies and what that does. So I have a little visual here. See if I can pull it up, see if it'll work, to explain what the fascial line is and why it's important. So this right here is our fascial line. We're going to get real close to the camera.
Okay.
And as you can see, it starts at the base of the skull over here and wraps around the front of the body, all the way down the leg, under the foot, and back up the other side to end under the opposite side of the skull. It's fascinating. And what that means is, hypothetically speaking, let's say that you're a shallow breather and your diaphragm is tight right in through here. That tight diaphragm can actually move up the spiral line and give you pain in the neck and shoulder, or it can move down and manifest pain in the hip. It's not impossible for it to even move down as far as the knee or the ankle as well. So what remedial work does is it takes a look at that spiral line combined with other areas of pain or dysfunction you might feel. And it's a little bit like being a detective. You get to dive in and investigate above and below your areas of pain to try to smooth everything out all at once and improve function.
So is there like a point in time where somebody does not need to have their fascial line worked on? Is it something that ever gets all the way, quote unquote, better? Or is that kind of because I would think that is something that needs constant maintenance, much like even if you're in great shape, much like an oil change or, tire rotation.
Exactly. I'm so happy to hear you say that. That's what I tell people all the time. People are very diligent about getting their oil changed, getting their tires rotated, getting their alignment checked. But, we don't always take care of our true daily driver, which is our body. We use it all day, every day, regardless of, even if you're just sitting at a desk, that still is a series of small, precise movements performed over and over again throughout the day. So that still requires attention and care and maintenance.
Absolutely.
So
Yeah.
it's not
And
just for athletes that need this work.
honestly, I for me personally, sitting at a desk is much more hard on my body than up and moving all day long. I mean, that's just for me personally, but it's like,
very
yeah,
hard.
I can tell. I can tell the days that I'm doing a lot of computer work, my body feels it. You know, so I mean, I 100% agree with that. So if somebody's never had a massage before, and they're surprisingly, I've talked to a lot of people that have never had one, you know, what is something that you would tell them before coming for their first massage to kind of prepare them?
When you find your therapist, or you find the therapist or the company that you're wanting to work with, ask your questions. Don't be afraid to ask questions, and any therapist should be able to answer those questions confidently, honestly, and fairly quickly. So if you don't know what you want, that's perfectly fine to tell your therapist, I've never had work done before. I don't know if I'm looking for a deep tissue. I don't know if I need something lighter. And they should be able to work with you and begin probably on the lighter end of the spectrum and increase pressure as they go until we find somewhere that you're comfortable, pressure wise. So yeah, ask your questions. If you do know that you like deep tissue, don't be afraid to ask for a deep tissue therapist or for deeper pressure. And that's not just at the beginning of the massage, that can be in the middle of the massage as well. If we as massage therapists love and encourage feedback with people on the table, because it's important for us to provide the best session possible for you. And the best way to do that is through open and clear communication. So don't worry about hurting our feelings. Don't worry about, overstepping. The session is about you and your comfort level and getting you the best optimal results for what you're looking for. And some people want to relax and just want to be, just gently worked on for an hour. That's perfectly fine. Some people want a nagging ankle problem they've had for several years fixed. Yeah. And so that's why it's very important to have that communication. Some places will prompt you for that, and other places won't. It just depends on the practitioner and what company they're working for. So don't be afraid. Don't be afraid to ask a lot of questions to whoever you're on the phone with, and then again to the actual therapist that's doing your work. That's the most important one right there.
Absolutely. And so do you think that when somebody comes to you for a massage, do you think it's best to start out with a more relaxing massage if they've never had one before? Because I know me personally, I like the deep tissue, but again, I have had lots of injuries and, I have a lot of kids, a lot of responsibilities. So I do not get into massage therapists as much as I should. So when I'm there, I'm like, we've got to get this done. It doesn't matter if it hurts. We need to get this done type of thing. But I wasn't sure, like, is there a right and a wrong as far as that goes, or just kind of just depends?
It's, that's one of the fantastic things about this profession is it is so fluid. There is no right first massage. I always tell people, if they're not sure, go for a medium. Just ask them to do a medium session, because that's kind of baseline. And the thing to be aware of though is medium pressure is not the same across all therapists. Yeah. So it's one of the few professions where you have 30 individuals in a classroom and they're all learning the same thing, and you'll end up with 30 completely different practitioners at the end of it.
Yeah.
Unless they're memorizing like a set routine. Like I do know places like Charles Pinzone has a set routine that each individual has to learn. Places like that, you'll get roughly the same session every time. But generally working with a therapist, it'll be different, at least in some aspect, from therapist to therapist. So when you find I'm sorry?
I said I would think it would be different.
Very, very different.
We have a couple of Sorry, I didn't mean to interrupt you. I was going to say we have a couple of people that mention here, Mick Manhattan and Tim. I've never known how to say Tim's last name. So Tim, don't know how to say your last name. I need to ask you that. I've talked to Tim several times at this point, and I always make up his last name. But he's great. maybe that's what Bazio, but they both have podcasts. They're both podcasters, and podcasters are like a big community. And so a lot of us jump on each other's shows and say, hey, shout out. So, but yeah, I didn't want to cut you off though, but he said by Seagull. So there we go. By Seagull. There we go. Say I possibly won't remember that, but it's okay. So yeah, I mean, as far as like, I would think that just with pressures and technique and even personality may kind of come out in the massage, because I've been to a lot of different massage therapists, and there's some that didn't work out for me because it was on my end, and there was actually some that quit on me. That's like, you're too hard to work on. I was like, okay. I was like, and I actually make it a joke now. I'm like, yeah, I've had massage therapists quit on me. So, but so
did they at least refer you to another practitioner that could suit your needs better?
A couple of times. Yeah. And I have a girl that's local that, her name's Candace Stevens. She's local to me here, and she does a great job. But before that, yeah, I had a couple of people say that I was too hard to work on. And I don't know, I've never been a massage therapist, so maybe that happens, but I was just kind of like, oh, I mean, because how do you fix that? I mean, my body is my body. So, it's like, I'm sorry.
Yeah, I'd be like, I wouldn't know what to say. I'd be like, thanks.
I just made it a joke. I'm like, well, that's kind of how it was. I was just like, okay, well, I'm sorry about that. But yeah, it's funny. But Tim has a question for you. He said, why do some therapists use oils for massage and some do not? What's the difference?
Well, it really depends on the amount of traction and glide, and also the style of massage that you're doing. If I want more control over the tissue and I want to do more of a grabbing, separating type work, I'm going to keep it drier. I'm going to use maybe a little bit of cream or a little bit of powder or just a smidge of oil, just so that I have more control over the muscle. And again, part of it comes down to personal preference of the therapist. Some therapists learn that the only way to massage is with a copious amount of oil, and you'll have someone who uses a relatively higher amount than I would. But it really kind of boils down to preference, and if they work for a organization, what the organization purchases. So I myself, I prefer a gel. I find it makes a really nice medium between oil and cream, and you don't have to use very much of it, so you're not super slick at the end of the session.
Oh, I've been to some where I feel like I just have been swimming in oil. I get done and I am shiny.
I'm personally not a fan of that. There's nothing wrong with it, but it's just, I have for being a massage therapist and being in oil all the time, I hate like odd textures and sliminess or stickiness. So that makes me crazy.
Yeah. Luckily the girl that I get to now, she uses a little bit of oil, but I don't come out of there looking like an oil slick. So I was curious. That's a great question, Tim. I was kind of curious about that as well. Cause now I would think, and maybe I'm wrong about this, but I would think that, if somebody's doing a lot of massages in a day, that putting oil on there may make it easier on their hands to do that many. Mm-hmm. But I'm completely making that up in my mind just based on how I would think, it would work. Would it be easier to work on as far as like the massage therapist side of things? Because I would say that's hard on your body to do that all day.
The more oil you use, the less friction there is. So it's easier. You can move farther with less effort. So yes, I would say it is easier with an oilier or more product that's used. And yes, massage therapy can be very difficult on the body, which is why body mechanics are so crucial, which is the way that you hold yourself during a session. We do what's called joint stacking, where it's just the most efficient use of body weight and body mechanics. Yeah. Mm-hmm. And self-care, another huge thing. I get massages twice a month at minimum, sometimes more. I see Dr. Suzanne Pakula, whom I believe you're acquainted with, and hopefully will be on the show at some time. She's fascinating. I see her weekly. And there's also a physical therapist that I go to once a month who's fantastic. His name is Jim Krupar, and he's in Dublin. He's great. But yeah, that kind of rounds out my self-care that I just do to take care of myself and keep myself going. I also have kids. I have a busy life, business owner. So I understand that, and how important it can be.
Absolutely. And, I think that self-care is one of those things. I think a lot of people have this idea that self-care is just like the bubble baths. And some people think massages, but they think like just like we were talking about earlier, just the relaxing, shoulder massage. But really, self-care goes so much farther than that. It's really taking the time to think about what your body needs to do on a daily basis and how to properly give it those tools. And for some people, that they may need to add a lot more depending on what their day-to-day life is like and their daily requirements are. Tim has, let's see, he said, I've had both massages. The dry massage is good if you have a good therapist. Otherwise, it just feels like they're trying to tie a knot in your muscles. I think it makes a big difference.
Yes.
Wow.
Sometimes I know it takes a long time to find the right massage therapist for you. If you're just going and you're going to relax and you don't really have like a goal in mind, it's not such a quest. But for me, I had a therapist I'd worked with for several years, and she was phenomenal. And she moved to Cincinnati to take a position at the hospital there. And it took me every bit of 6 months, still having regular work, to find my therapist, the one that I felt did the best work for me and was most effective for me, because it is such a wide range of practitioners and styles.
Absolutely.
So you're right. It's just because a therapist didn't jive with you and you didn't like what they did, keep looking. Give another couple places a shot, because your therapist for you is out there. And again, communication. If you feel like your muscles if it's too much or they're not, it's uncomfortable, communicate, let them know that, so they can back off, or they can add more, they can change the area that they're working on. I always tell my patients that since it is such a subjective, pressure is so subjective, I try to tell them to imagine their 1 to 10 pain scale. 1 is like a paper cut, no big deal. 10 is like they're ready to start sweating blood. We never want to keep them much above a 6 or a 7 for too long, more than a couple of minutes, because at that point, the muscles will clamp down, they'll lock up, they'll tighten up, they'll push me out and end up making you very sore. So pain definitely has a place with deep tissue and remedial massage work, but it shouldn't be the whole hour.
Yeah, I can see that. And I know for me, this is actually the first time that I've only had one massage therapist. In the past, especially when I was fighting still and training fighters, I had several different ones, because again, it is very subjective to how the person works on you. And, I had different ones depending on what I had going on and what my goal was, because you mentioned goals. And I think a lot of people don't really attach massage therapy to a goal other than relaxation or pain management. Usually those are the two. But really, there is a lot of very specific goals that, you can actually attach to massage therapy. Can you kind of give, for people that don't know what I'm talking about when I say that, can you kind of give some overview reasons that people would need to come to massage therapy other than pain relief or, relaxation, or the kind of the normal ones we think about?
Absolutely. So golfers, I love working on golfers. With the way that we swing, our hips, usually the planted foot will get really tight and locked up, and they're not as able to follow through as well as they would be if they were loose. So I see a lot of golfers looking to improve their swing. I see a lot of runners looking to improve their time or to improve their flexibility. I see a lot of MMA and jiu-jitsu practitioners that are trying to enhance their flexibility. It's kind of funny. Firemen, every few years, they have to take a physical, and a bunch of strong guys, not necessarily flexible. So when the firemen start rolling in and they're like, I got to be able to reach past my toes, I got to get this bonus, then, so there you go. There's another one. Children. If you have a child who's a toe walker, or a child who is bow-legged, or, they're not in pain per se, but these conditions could cause them trouble down the line, we do work with them as well. So let me see. Women that are close to their due date, their delivery date, they're not in pain per se, in some pain, because being pregnant's hard.
Yeah.
They're not, they're not in agonizing pain, but they just want their muscles to be primed and ready to deliver a baby. We treat that gently, of course, but the same as we would an athlete getting ready to have a pre-event session done, because it's very
which
hard
is,
on the body.
yeah, it is. And I think a lot of people don't think about that. That's something I wish I could go back, because I mentioned I have 7 kids. I wish I could go back and go and do that pre-care before my labor. It was kind of one of those things I did not do.
Mm-hmm.
So you've always got so many things on your list, and it would just never happen, never happen, never happen. But all the years of not completely 100% keeping up with my own self-care, I feel it now. And a lot of people attach the self-care, like we mentioned, to relaxation, but
Mm-hmm.
also to eating right and exercising. I never had a problem eating right. I'm a nutritionist. I never had a problem exercising. What I had a problem with was making sure that I was giving my body the proper tools apart from those 2 things, which
Mm-hmm.
was making sure that I seen the chiropractor as regular as I should. I seen the massage therapist as regular as I should. I didn't do a great job of that. And now, well, Suzanne sees me, and she could tell you the stories of my body at this point. And it's, I tell my kids even now that it is super important to keep ahead of it before it's a big problem, because once it's a big problem, it's so much harder to go backwards.
Mm-hmm. And the body, like you said, the body keeps score, and the body remembers. And that's a fascinating phenomenon. And what I do is it's muscle memory.
Yeah.
And hypothetically, sometimes I'll be working on someone, and I'll hit a specific spot or specific area, and they'll start talking about a car accident that they had years ago, or caring for their parent when they were sick. And the muscles memories can be attached to areas of the body, and when we work on those areas, it helps the brain to process those thoughts and those experiences. And sometimes it's a way to help people let go. An important aspect of self-care that you mentioned that we've not mentioned, that I do want to touch on, is the mental aspect as well. And that's not my field, not my realm per se, but I do want to, self-care, as you said, is not just bubble baths, and it's bubble baths and nutrition and massage and exercise, and doing the mental work to make sure that we're all in good places and being the best that we can.
Absolutely. And it all ties together to make a full, whole person. And I think it's
Yes.
important to figure out all of those different pieces. Michelle Moy said massage therapy has saved her both with pain, sore muscles, and for relaxation. And I think that's something to mention. We've said it's not for relaxation, but it's okay to use it for relaxation, because,
Absolutely.
life can be stressful. And just the idea of going and laying there and not having to think about your to-do list, not having to think about all the things you could be, would be, should be doing,
Mm-hmm.
that can be a great part of self-care. It's important to do. It's super important to do. I love that.
I have massage. I have several patients of mine that are kind of funny. I'm not their primary massage therapist. They see someone else very regularly and have a wonderful relationship, but I'm just their emergency in case of emergency break glass therapist. If something's been persistent or not resolving itself, and we jump in with a little bit more specified work, a little bit more deeper work, and then they feel better. They go about their day. I'll see them again in 6-8 months, a year later, and just as needed basis.
Yeah. And I think that's great. I mean, like I mentioned earlier, I've always had, up until recently, I actually need to fill in some of the slots again. I like to see different people, because different people notice different things, and a lot of times, even though I'm very in tune with my body, a lot of times I can tell there's an issue, but I can feel all the places that it is.
Yes.
And it's hard to pinpoint exactly where it's coming from. So having that outside perspective is super helpful. And being able to have multiple perspectives, I think is even more helpful, because then at that point, even if you've got somebody great, which I love Candace is fabulous. And anybody that's local to me, Candace Stevens does massage, and she does great. But I've in the past, I've always had more than one person, because, it's been something that is like, oh, they would notice this, but then they would notice this. And it would be some of those things that we could get some stuff resolved a lot more quickly, because you had those different perspectives.
Absolutely.
Do you work along with other massage therapists? I mean, is that something that, okay.
I do. I have several. I have 3 right now that I primarily refer to, because I've had their work.
Yeah.
I think that they're knowledgeable, and a lot of them provide services that I can't, as far as like traveling services or time services. And I would be happy to append their names and contact information after the show if anyone's interested, as well as my own. But yeah, I have. There's actually a woman in the same office as me. She has a fantastic relaxation and a lighter remediation work. She's really good. I have a wonderful light pressure therapist who she's very, very knowledgeable, located in Upper Arlington. Very good therapist. And then there's Mr. Allen. Allen he is Thor's hammer. He is a very deep tissue therapist, but he is very good at what he does.
Thor's hammer sounds great, actually.
Yeah,
I typically get super, super deep massage, and and I think that's been a problem with some of the people up until I found Candace. Some of the people in the past, they'd just be like, I felt like it was just like a feather, and that's great for some people, but for me, I was like, I need to get the pain relief. So I love that, you're so open to working with different people, because I am a big believer in collaboration. I mean, Absolutely. On all levels, because everybody has their own specialties and the things that, even though you may be able to do all the things, you still have your few things that you're the best at, and being able to kind of really piece those together, you're able to serve, your patient, your client in a full manner that way. I really like that.
We all have our blind spots, and there are certain things that I am just not great at. I am not great at super light pressure. That is just not, I'll be the first one to tell you, if you're wanting to just like feather light work or even super light work, I'm not your girl.
Yeah.
And I will happily refer out. And there are some cases that I feel I just don't have the tools to address their concerns and their needs. And I think, there is more than enough work for everyone to be successful and to be connected, and to, it takes a village. And I feel like we should all, as healthcare practitioners, massage therapists, chiropractors, physical therapists, and so on and so forth, we should not be afraid to refer out and to build relationships with our peers, because,
Absolutely.
what's the old saying? No man is an island,
Yeah. Well, and at that point, I think it connects this trust factor with the patient that, they're able to trust you much more deeply, because at that point they know that you are looking at their best needs, and,
Absolutely.
It's able to create those relationships on all the levels. And I love that. I know we're running short on time here, but I do want you, for people that are local to you, or maybe not local to you, if they can find you maybe on social media, on your website, like kind of give a shout out of where you can be found.
Absolutely. I have a Facebook page. I have a online booking service, and I have a website.
Okay.
So your best bet is to type in, just as my name is here. There we go. Okay. Here on the screen, Brittany C. Zerkle, LMT, into Google, and it should bring everything up. You can go to www.massagebook.com and search in that name as well, and I should pop up. Also on Facebook. So Facebook, massagebook.com, and just a general Google search should pull me right up.
Awesome.
So I'm located in Grandview, actually, near the corner of Grandview and First Avenue. And yeah, I see patients in the afternoon and the evenings every day except for Thursdays and Sundays.
Awesome. And it's been great. I actually learned a lot. It's funny. I love having guests on, because you learn so much from the other person. And even if I was to bring on 10 massage therapists right in a row, I would still learn something different from every single person. And
every single one. Yes.
So it's great. So thank you so much for being on. And if anybody is interested in talking more with Brittany, or to find out about what she has to offer, go to Brittany C. Zerkle, and you can book an appointment with her. You can ask some questions, and it's been great having you on. Thank you so much.
It's a pleasure. I'll be sure to, I'll send you my phone number, as well as the number of those other therapists that I recommend, in case you want to post them in the comments after the show.
Perfect. Thank you so much.
Thank you. It was a pleasure. It was so nice to meet you, and so nice to be here. I really appreciate it.
It's been great. And I want to give a shout out to Suzanne, Balance Chiropractic on Fifth Avenue in Columbus. Is that considered Upper Arlington too?
That is actually that's in Marble Cliff is where that is. It's very close to Upper Arlington and Grandview. It's right on the edge of 33 there.
Yeah, she's a great chiropractor. She's, definitely thinks outside of the box and looks for the cause of what you have going on. And I can't say enough amazing things about her.
I too am a patient of Dr. Suzanne Pakula's. I see her every week. I think she's phenomenal. Will she be doing interviews with you at some point?
She's going to, yeah, she's going to be on here, and
That's
you know,
awesome.
we do some different things together, and she's been amazing. I
Good.
wish she was like right here in my, like I drive to see her. I mean, and that says, I mean, I drive almost 2 hours to go see her, if that
Wow.
tells you anything.
That's amazing. Yeah.
So yeah, she's been great. So, all right. Well, thank you so much for being on here. And yeah, you send me the stuff and I'll drop it in the comments so people can get in touch with you. Thank you.
Thank you. I appreciate it so much. Everyone have a nice